Are you alright, mate? Open your eyes, mate. Hello? Trevor? Somebody help me, please? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Basic life support needn't be intimidating. As with any other first aid emergency, start with the primary survey. Check for danger and shake and shout to establish response.
Somebody help me, please!
Once you've called for help, quickly open and clear the airway by inspecting the mouth and gently tilting the head back. Then take up to 10 seconds to establish whether or not the casualty is breathing. In this scenario, the casualty is not breathing normally. Agonal gasps occur commonly in the first few minutes after sudden cardiac arrest. They should not be confused with normal breathing. If the casualty is not breathing normally, summon an ambulance immediately by dialing 999. On your return, lock your fingers together in the center of the chest and begin a set of 30 compressions.
16, 17, 18, 19, 20.
Keep your arms straight and your body weight over the top of the casualty.
28, 29.
Now, pinch the casualty's nose and get a good seal around the mouth. Blow gently so that the chest rises. Administer 2 of these rescue breaths before returning to the cycle. 30 compressions followed by 2 rescue breaths. The compressions are at a rate of around 100 to 120 per minute and a depth of about 5 to 6 centimeters.
30.
Ensure the casualty has a good airway as you pinch the nose and administer the 2 rescue breaths. Again, back to 30 compressions. Lock your fingers, keep your arms straight and your body weight over the casualty. Stop to recheck the victim only if they start to show signs of regaining consciousness, such as coughing, opening their eyes, speaking, or moving purposefully, and start to breathe normally. Otherwise, do not interrupt resuscitation. The cycle of 30 compressions and 2 rescue breaths ought to continue until paramedics arrive at the scene. But if you're beginning to feel the strain, consider sharing the resuscitation with another qualified colleague. Take turns of about 1 to 2 minutes, allowing each of you time to recover. Remember, the casualty is not expected to breathe spontaneously during basic life support. It's a holding action until more experienced medical help arrives. By carrying out early basic life support, you give the emergency services the best possible start to saving the casualty's life. A note about delivering rescue breaths. If the rescue breaths don't go in, check, clear, and open the airway before trying again. Don't attempt more than 2 breaths before recommencing with 30 chest compressions. When carrying out rescue breaths, you may consider protecting yourself with the use of a face shield or pocket mask. If you are untrained or unable to administer the rescue breaths, carry out continuous compressions at a rate of 100 to 120 per minute.